So we encourage the patients to definitely always refer to the handouts that we give them prior to surgery. And we reiterate these things along after their first follow-up and their 1-month post-op follow-up. We tell them to follow the dietary phases as instructed. So they have about 2 to 3 days of clear liquids after surgery, and then they start their 2 weeks of full liquid, and then they have after that a 1 month full of 4 weeks for the soft food phase, and then they'll start their dietary phase for lifetime, which is solid foods. We tell them not to start ahead of time because there's a purpose for the length of these phases to promote healing. And we always encourage them to try to stay away from a lot of those sugary beverages because sometimes we can easily drink our calories without even realizing it. Carbonated beverages, we also encourage them to stay away from that. A lot of the starches like potatoes, pasta, rice, we encourage them to try to really minimize that and focus and prioritize their protein, whether that's on the full liquid phase of drinking their protein shakes until they get through to the soft food phase, but prioritizing whether it's the chicken or anything first, and then if they have room, they can have one of those lower carb starches for the vegetables, for instance. But following closely with the nutritionist as well, because she does see bariatric surgery patients post-surgery. So making appointments on a one-on-one basis is also very important for success. So we promote joy, we promote quality of life. We know that part of the enjoyment of getting together with family is also partaking in, meals together and so on. And we approach it with things in moderation. So, every now and then, if you want that little piece of chocolate or if you have a favorite food that you enjoy, we encourage that in moderation. Primarily, you do want to focus on foods that are going to be those low fat, those lower carb, high protein. And when we do and low sugar, when we do talk about carbohydrates and you do eat those carbs, it tends to be you want to focus on the complex carbohydrates, the whole grains, right? Versus things like white bread or a lot of cake or things along those lines. So we're all about quality of life. We know there's going to be celebrations, there's going to be holidays, and it's okay to enjoy yourself and eat those different foods at times, but also know that you know yourself best. So sometimes reaching for that one piece can also turn into more of an everyday occurrence. So just being truthful to yourself, if you're able to do it just once in a while or in moderation, and just try to follow through with those healthier options overall.